Welcome to the community analysis of Neptune Beach, Florida. The objectives of this presentation are to provide a description and history of Neptune Beach, an analysis of the structure, population, health-related resources, environment, and local government, as well as prioritized community needs and a discussion of community needs from a global perspective. Neptune Beach is an oceanfront community located to the south of Atlantic Beach and to the north of Jacksonville Beach. The history of Neptune Beach really begins in the late 1800s when a wealthy jeweler from New York bought 200 acres of land from the state and had a plan to develop the area. That didn't happen, and in 1900 the East Coast Railway bought the land. With just a handful of residents for the next 20 years, Neptune Beach remained undeveloped. In 1922, Dan Wheeler was tired of commuting all the way to Mayport to catch the train into Jacksonville and decided he wanted to build a train station by his house, which he did, and he named it Neptune, and the name stuck. In 1931, Neptune actually becomes a town when it secedes from Jacksonville Beach and becomes the town of Neptune. In 1953, the town is renamed to the city of Jacksonville Beach, which it's now known as today. The other major turning point in the city's history was in 1968 when Neptune Beach voted to become an urban services district of Jacksonville, and we'll discuss that later in the presentation. The structure of Neptune Beach, for the most part, meets the needs of its residents. There are 3 public schools, an elementary, a middle, and a high school, as well as numerous private schools, and some of the larger ones are listed here. The city also provides many opportunities for entertainment, shopping, and dining for its residents. The Beaches Library is a large branch of the Jacksonville Library System that provides not only basic library services, but several reading programs for children as well as adult learning opportunities. There's a town center that's the hub of activity for residents and visitors alike. There are large chains for residents. Publix, CVS, and Walgreens are some of the examples of shopping opportunities for residents. There are also many small, independently owned businesses in the city, anywhere from hair salons to art boutiques. It's not very large business friendly, but there are many small businesses. There are also many places of worship for residents. And one of the benefits to being an urban services area of Jacksonville is that Neptune Beach has good public transportation. When looking at the population of Neptune Beach, there are a few things that stand out. Population density is nearly double that of Duval County at nearly 3,000 people per square mile. Median income is more than $20,000 above the county and state level, so it's an affluent community, relatively speaking. With that being said, unemployment is still in line with state and county statistics at nearly 7%. Also, nearly 7% of residents are below poverty level, which is well below county and state levels, but still that means that over 500 residents are living in poverty in Neptune Beach. Nearly 95% of residents are Caucasian, and one other thing that stood out is that the median age of Neptune Beach residents is greater than Jacksonville, Duval County, and the state at 41.5 years of age. There are general issues and potential health issues related to the population statistics. Some of the general issues are crowding, parking and traffic, lack of resources for the poor within city limits, vagrancy, lack of diversity, and an aging population. Some of the potential health issues related to that: chronic diseases such as heart disease, diabetes, and COPD, cancer, drug and alcohol abuse, and smoking, which includes electronic cigarettes. Healthcare resources within Neptune Beach itself are limited, but there are a few options. There's a Care Spot, which is affiliated with Baptist Health. That's the only walk-in provider within city limits. There's a CVS, Publix, and Walgreens for prescriptions and immunizations. And there's a handful of small private practice offices for adults and pediatrics. For more comprehensive care, however, you have to go outside of city limits, but there are many options that are less than 8 miles away. Baptist Health Beaches, which is a comprehensive acute care facility, is 2 miles away. They have an emergency room, comprehensive stroke center, as well as a cath lab. Mayo Beach's primary care. Mayo Clinic itself is actually 7 miles away. Beaches Family Health Center, which is the Duval County Health Department facility. Mission House Jacksonville, which is a facility which has a small clinic for homeless and veterans. And then there's St. Vincent's Primary Care. Some of the issues related to healthcare resources include a wide variance in access, acceptability, and affordability. There are a few low-cost and free clinics, such as the Mission House and the Beaches Family Health Center. But Mayo Clinic, for instance, is very selective in what patients they will accept. And the Beaches Hospital, Baptist Hospital here, will take a wide variety of insurance, and they're an emergency room that cannot turn patients away based on their insurance status. So there's a wide variance in all of these factors. There are limited resources for low-income patients, limited access to mental health resources. You actually have to go across the bridge into Jacksonville for mental health services, lack of assisted living, and skilled nursing facilities. Again, you have to go over the bridge into Jacksonville for these types of facilities. When looking at Healthy People 2020, there were a few objectives that stood out and applied to Neptune Beach. Access to health services. This doesn't just mean that you have health insurance and can afford health care. Even though this is a relatively affluent and educated community, that does not mean we can assume that residents know how to navigate the healthcare system and get access to the providers that they need. And that is just as important as having health insurance and being able to afford health care. The second objective is overall health-related quality of life and well-being. This is a relatively new objective for Healthy People 2020 and really takes into account the health of the person beyond the clinical numbers. So taking into account mental well-being and spiritual well-being and the health of the person as a whole. And Neptune Beach, this really applies to that community because the residents seem very receptive to this type of objective. And also the third objective is educational and community-based programs. This is an area that is lacking in Neptune Beach. It seemed it was hard. This author was hard pressed to find programs within Neptune Beach. Residents have to go to Jacksonville Beach. While it's not far, it's still not within their own community. Looking at the environment of Neptune Beach. Neptune Beach Police Department has a very active presence in the community with several outreach programs, and they really strive to be unique. The Fire and Rescue Department is actually in Jacksonville Beach, and that particular fire station in the North Jacksonville Beach is who serves Neptune Beach. So they not only provide fire and rescue services, but also fire prevention education, hazmat services, as well as disaster planning and relief. Neptune Beach's Public Works Department oversees the stormwater management and the waterways, as well as the city's beach and Jarboe Park. However, Neptune Beach is otherwise an urban services area of Jacksonville. So Jacksonville actually provides the city of Neptune Beach with its drinking water, its pest control, solid waste management, and maintenance of streets and sidewalks. This is good because it doesn't come out of Neptune Beach's budget. However, it provides challenges because the city is at the mercy of what Jacksonville has budgeted for Neptune Beach. Some of the environmental issues of Neptune Beach: waste on the beach. Neptune Beach puts a lot of effort, the Public Works Department puts a lot of effort in keeping the beaches clean. However, on any given day, you can walk down the beach and find overfilled trash bins. You can find trash left on the beach and trash that is washed up onto the beach. There is a lack of bike lanes despite many locals utilizing bicycles, including a lot of children. A lack of lights at busy intersections. The City of Neptune Beach operates under a city manager council form of government. They're very responsive to the community. There's at least one council meeting per month, sometimes more, and all of them are open to the public. Meetings are very well attended, and there is audio of council meetings available within a day or two of the meeting, and it's easily accessible on the city's website. The mayor and the rest of the council seem to be very well received by residents, and the tone of meetings is very positive. One of the issues that the city is facing is when discussing this upcoming year's budget, nearly 2/3 of the annual budget is allocated for public safety, primarily the police department. And that is an area of opportunity for the city. And that seems to be related to issues with unions, and the council is looking for ways to reduce this. Some of the prioritized community needs: resources for low-income families within the city limits. As discussed before, the poverty level as a percentage may seem low, but there's still 500 residents living below poverty level in Neptune Beach, and they have to go beyond city limits to get resources. At risk for knowledge deficit of disease processes. Based on the median age being a little bit older than even the state of Florida, we can assume that the incidence of heart disease, COPD, diabetes may be a little bit higher in an area like Neptune Beach. So education programs, community education programs, and monitoring for chronic health issues such as these could be very beneficial for the residents of Neptune Beach. At risk for injury related to lack of bike lanes. Doing the windshield survey, this was probably the one area that stood out. A lot of traffic. There are no bike lanes. The sidewalks have cracks on them. There's a lot of children leaving school on their bicycles. They're riding on the sidewalks. They're riding in the street next to the cars. That combined with the lack of traffic lights at some of the intersections puts a lot of residents, including children, at high risk for injury. Community resource for long-term health care, assisted living, home health, and skilled nursing facilities. There are no services or facilities located locally, and it's not realistic to think that they're going to have any anytime soon. But a local referral resource would be very beneficial. One place where residents can go to get referrals for appropriate facilities beyond the hospital and basic care. Education and outreach related to alcohol and substance abuse. Elementary, middle school, and high schools combined have more than 4,000 students. Some studies indicate that adolescents are at higher risk for drug and alcohol use in more affluent communities. They have more access to alcohol and drugs. They have the means to get fake IDs and so on. So outreach and education at an early age to help prevent drug and alcohol abuse in this community would be very beneficial. Evaluation of the role of public safety in the community. Discussed previously, the public safety portion is the majority of the city's budget, and this could be taking money that could be used for other resources. And looking at things on a global level, education for prevention of chronic illness such as heart disease. There are many countries that have low death rates compared to the U.S. from heart disease. And looking at these, South Korea, France, Japan, and what are they doing? It may not be what they're doing, it just may be a lifestyle and something that the U.S. and Neptune Beach, for that matter, could look into for managing and preventing heart disease. France, for instance, people walk everywhere. They may have, by reputation, a rich diet, but they're always on the move and always active. So looking at some of the things that these countries do and apply them to Neptune Beach could help with educating residents on how to prevent and manage heart disease and prevent death from heart disease. Neptune Beach, following that, Neptune Beach has no consistent formal education related to chronic illness. This is definitely, as discussed before, an area of opportunity for the community. Thank you for listening.